According to the Centers for Disease Control and Prevention, approximately 95% of parents nationwide choose to vaccinate their children, and Mississippi ranks near the top for vaccination compliance among kindergarten-aged children. Barbara Lowe Fisher, co-founder and president of the National Vaccine Information Center in D.C., has worked the last 3 decades leading campaigns to institute vaccine safety reforms and informed consent protections in the public health system. Thank you so much for joining us, Ms. Fisher. Talk to me a little bit about how did you get into this type of advocacy work?
In 1980, my 2.5-year-old son suffered a convulsion, collapse, and brain inflammation within hours of his 4th DPT shot. And he was left with multiple learning disabilities and attention deficit disorder and had to stay in a special education classroom in the public school system throughout his education. That prompted me in 1982 to join with other parents of DPT injured children in 1982 and to co-found the nonprofit organization known today as the National Vaccine Information Center. Our mission was then and is today to prevent vaccine injuries and deaths through public education and to protect the informed consent ethic and vaccine policies.
As a mom back in the 80s, at that time, did you feel like you were informed about what the possibilities of what could happen when you had your child vaccinated?
You know, when I was a new mom back in 1978, like most new moms back then, we were given no information by our pediatricians about how to recognize vaccine reactions, symptoms of vaccine reactions, about the diseases. We were just not given any information. And so when my son had a convulsion, a collapse, and a brain inflammation within hours of his 4th DPT shot in 1980, when he was 2.5, I didn't know what I was witnessing that day. I didn't understand that he was having a severe reaction. And this is something that all parents need to understand, that sometimes vaccines do carry risks that can be greater for some children than others. And we need to be informed, and we need to learn how to prevent these types of reactions from happening.
Do you feel that the vaccines have changed from the 80s till today?
Well, we certainly have 3 times as many vaccinations that are recommended by the federal government and are required by state governments today than we did back in the 1980s. So there are many more vaccines today. There are also vaccines today for diseases that don't really match the types of diseases that we vaccinated for in the past. Smallpox was the first vaccine that was recommended and mandated by government. That was a very serious disease with a high rate of complications and death. Today we have vaccines on the mandated list that are not as serious as smallpox, like chickenpox. Like hepatitis A, which is basically a diarrhea that you get in poor sanitary conditions. We have vaccines for diseases like hepatitis B that cannot be transmitted in a public setting. So the vaccine schedule today not only contains more vaccines that are recommended by government, but also different types of vaccines for different types of diseases that we didn't vaccinate for in the past.
So where's the disconnect when it comes to the information that you guys are putting out now and the public health care system?
Well, the information that the National Vaccine Information Center puts out is well-referenced information about both the infectious diseases as well as the vaccines that are recommended by government. We link to many different sources, including the CDC, the FDA, NIH, the vaccine manufacturer product insert. So the information that we provide to the public is quite similar to the vaccine information that is provided by government and the vaccine manufacturers and doctors. What we, however, do is we encourage everyone to be fully informed about both the benefits and risks of vaccination, and then be able to make an informed voluntary decision. We support the ethical principle of informed consent to medical risk-taking. And that means that you have the right to be fully informed about all risks that are associated with a pharmaceutical product, including vaccines or a medical intervention, and be able to make an informed and voluntary decision about whether or not you're going to accept that risk for yourself or your child.
Tell me a little bit about why is that a problem when it comes to physicians and even just new moms when they're going to get their children vaccinated? Do they even really pay attention to that information that's being put out there?
Well, you know, the National Childhood Vaccine Injury Act of 1986, which was passed by Congress, did mandate that doctors are supposed to be giving parents vaccine information, the vaccine information statement that is published by the Centers for Disease Control. We know that most doctors are not giving those statements to parents before their children are vaccinated. They're often giving them to parents when they walk out of the doctor's office after the children have been vaccinated. And that's not the way those information statements were supposed to be used by doctors. It's really important to be fully informed before you take your child in for a vaccination. In most cases, children are getting anywhere from 5 to 10 vaccines on one day when they go in to get their children vaccinated. So you need to get that information in the appointment before you take your child in, not at the appointment that you're taking your child in to be vaccinated. You need to understand the signs and symptoms of a vaccine reaction, and you need to understand circumstances under which your child shouldn't be vaccinated, because there are contraindications to vaccines. So the message that the National Vaccine Information Center has is be a partner with your doctor in preventing vaccine reactions and injuries.
Why do you think there's a growing number of pockets of unvaccinated individuals?
Well, what we know is that there are individuals, as I said, who cannot get vaccinated because they have, for example, had a vaccine reaction to a previous vaccination. They may be allergic to a component of a vaccine. And so there are some people who can't get vaccinated. There are also some people who have personal conscientious belief reasons for not using one or more vaccines. And we support the right of all Americans to be able to have flexible medical conscientious belief exemptions in vaccine laws. Because we're not all the same, we don't all respond the same way to vaccines or infectious diseases. Vaccines do not always protect you. You can be fully vaccinated, still be infected, still transmit infection, sometimes without any symptoms. So this is an area, the issue of vaccination and health is an area where there are a lot of gaps in the science. We need to know more, we need to do better studies, but we also need to be able to have the right to exercise informed consent to vaccine risk-taking.
You mentioned gaps. Specifically, what do you speak on when you're talking about those gaps?
Well, between 1991 and 2013, the Institute of Medicine published a series of reports about the medical literature and evidence in the medical literature that vaccines can cause different kinds of brain and immune system problems. And one of the most shocking conclusions of almost every one of those reports is that there are huge gaps in vaccine science. In other words, we don't really understand the reasons why vaccines cause injury and death for some people. The Institute of Medicine acknowledged that there's individual susceptibility for biological, genetic, and environmental reasons for why some people are more susceptible to suffering vaccine harm. But the problem is all of those reasons have not been identified by science. So the real take-home message is we have to do better science and more science.
You mentioned gaps. Specifically, what do you speak on when you're talking about those gaps?
Well, between 1991 and 2013, the Institute of Medicine published a series of reports about the medical literature and evidence in the medical literature that vaccines can cause different kinds of brain and immune system problems. And one of the most shocking conclusions of almost every one of those reports is that there are huge gaps in vaccine science. In other words, we don't really understand the reasons why vaccines cause injury and death for some people. The Institute of Medicine acknowledged that there's individual susceptibility for biological, genetic, and environmental reasons for why some people are more susceptible to suffering vaccine harm. But the problem is all of those reasons have not been identified by science. So the real take-home message is we have to do better science and more science.
The CDC, are they not stepping in? Are these gaps that they're ignoring? You know, what's being done about this?
Well, that's a subject of a lot of debate among parents. Is we have been asking for the scientific studies to be done. We have specifically been asking for a comparison of health outcomes of children who get the federally recommended schedule of vaccines today, and that is 69 doses of 16 vaccines between the day of birth and age 18. 49 doses of 14 vaccines are given before the age of 6. That's, as I said, 3 times as many vaccinations as children got in the 1980s. We would like a study comparing the children who get all the federally recommended vaccines on schedule with children who get some of the vaccines and children who remain unvaccinated. There are some children who are unvaccinated in this country. We can do that kind of study. We can compare the outcomes of vaccinated and unvaccinated children and answer some of these outstanding questions about whether or not children who are highly vaccinated are suffering more chronic health problems during childhood and later in life. This is the big question that parents want answered, and this is the question that needs to be answered so that we can do a better job of screening out children and helping to prevent vaccine injuries and deaths.
Where do you weigh in on looking at the benefit of society or communities versus individual rights, particularly when it comes to immunizations?
Well, I think we all have to recognize that as parents, our first obligation is to make sure that our children's health is protected. We have the responsibility, ethically and legally, to raise our children, to make sure that they're nurtured and they are healthy and they can become productive adults in society. Not every child can go through the process of vaccination without suffering an injury or even dying. And so we need to first protect our own children's health. And I think that if we all do that, we will, by extension, protect the community health. It shouldn't be a choice, community health or individual health. It's about all of us working together, valuing every child's life, and making sure that no child is put at unnecessary risk by a public health policy.
Do you find that parents actually feel that they have an option when it comes to vaccinations, or do parents actually feel like there is no other choice? You simply have to get your child vaccinated?
I think today there's a lot of pressure on parents to adhere to one-size-fits-all vaccine policies, to not deviate from the federally recommended schedule. We know that pediatricians are throwing parents out of their offices if they ask too many questions about vaccines, if they want to vaccinate in a different way than the federally recommended schedule. And certainly they're being thrown out of practices if they decline one or more federally recommended vaccines. This is not appropriate. What's happening here is parents are becoming very afraid of taking their children in to pediatricians who are hostile and angry and threatening them. This isn't the way to foster trust in either the vaccination system or the public health system or in pediatricians, frankly. So again, this should be about doctors and parents working together in a partnership to do what's best for a child, and not in every case is doing what's best for a child getting the child vaccinated with all federally recommended vaccines. We need to respect the individual health of individual children because we're not all the same. And so I think that it's unfortunate that we have so many doctors who are threatening parents if they don't adhere to the federal child vaccine schedule. But that's what's happening, and hopefully it will change.
Well, Ms. Fisher, this has certainly been informative. Thank you so much for taking the time out to speak with us. Is there anything else that you would like to add or to share?
Our position is that we must protect the human right to informed consent to medical risk-taking. And that includes the use of pharmaceutical products, including vaccines.
Thank you so much for joining us.